Hey everyone, you're now listening to Cup of Queens with Paige and Saray, and we're so excited to have our second male guest, Dr. Adams and Molly from Fargo Center for Plastic Surgery. Dr. Adams and Molly are full of expertise and knowledge from surgical to non-surgical procedures.
Dr. Adams talks with us about his favorite procedures to perform, how plastic surgery has evolved throughout the years, and how he feels he is able to empower women every day.
So grab your cup and enjoy.
Hello.
Hello. Hi, how are you guys?
We're doing well. How are you doing?
Good.
We cannot wait to talk with you guys. We've been absolutely dying to get to this interview because we're so excited to hear all the things.
We are excited too. We appreciate the invitation.
Yeah, absolutely. Well, Krista was awesome. She had reached out and she's like, I have a king to nominate. And so that's kind of how we all got looped in. But yeah, so we're excited to be with Dr. Adams and Molly. And so, tell us a little bit about the business, about your guys' selves. Really.
Absolutely. Yeah. So the Center for Plastic Surgery came about, opened in August of 2020. So right in the middle of the pandemic. And it's something that we set up kind of through my last year of training. And really the goal behind it was to have a location, or more of a destination, kind of within North Dakota. A lot of people have gone out of state, out of town, certainly for aesthetic treatments, certainly aesthetic surgery. And I wanted to bring that back and bring kind of everything that I learned along the way in some major metro areas and some really outstanding world-renowned practices. So that was really our goal. Our mission and kind of what we stand behind is really trying to both enhance and restore form, function, beauty, in kind of an all-encompassing, very tailored, specific, individualized approach. And we put a lot of effort and a lot of energy into making sure we give the best possible guest experience with that. So that's kind of how it came about. And we've been open. We're coming up on just about not quite 2 years yet, but we're getting close. And we moved into our new space here that we're in now 15 months ago too. So it's a little cramped already, but it's great to be in this space and be in control and be able to really provide the best environment to make our guests as comfortable as possible.
Mm-hmm. So your guys' new space is absolutely gorgeous.
So gorgeous. The photos that you guys put on your Instagram and all of your social platforms, it is stunning in there. It looks incredible.
We had a lot of great help.
You can tell that for sure. So, what led you to want to get into this career path, and what really intrigued you to go down this route that you're on?
That's a great question. I became interested in medicine pretty early. Probably middle school, maybe. And I think what got me interested was a love of science, a love of problem solving. And my mother, she's a nurse anesthetist now, but back then she was an RN. She did a lot of labor and delivery, and then she was just going back to CRNA school. So she is a huge impact on my life. I grew up on a farm, so I was always used to work with my hands, building, fixing, repairing, changing. And that's what kind of drove me toward surgery. So I knew that. Initially, I was thinking orthopedic surgery, actually. I did a lot of shadowing in orthopedics. And one day an orthopedic surgeon was talking about orthopedic surgery, and he said, "Oh yeah, orthopedics is great. It's got the biggest depth and breadth of knowledge and anatomy, second only to plastic surgery." And I said, well, what? I didn't know much about plastic surgery. We don't get a lot of education in our standard medical school curriculum about plastic surgery. But I said, oh, that's interesting. I knew what most people think plastic surgery is, which is predominantly cosmetic surgery. So I tracked down a plastic surgeon in Grand Forks when I was in medical school at UND. And his name was Dr. Brad Melland, and he was a plastic surgeon and a hand surgeon. And I spent a lot of time, I may have missed a couple of classes to go shadow him and scrub in the OR. And he's really kind of what got me interested. My first day, I had such a diverse caseload. Breast reconstruction using from the tummy, hand surgery cases, a facelift. I mean, it was just it just kind of opened my eyes to this field and how diverse it is. And it truly is. I mean, the plastic surgeons operate all over the entire body. You know, they often say everywhere except inside the dura, the covering of the brain, or the pericardium, the covering of the heart. It's pretty much everywhere else. So.
Wow. That is really incredible. It is such a wide range, which I'm sure keeps things interesting.
Absolutely. That's one of my favorite parts about it is no 2 days are the same. No 2 patients are the same. Everybody's got specific needs, specific anatomy and it's, you know, one size doesn't fit all. I don't do an open technique or a laparoscopic technique. Everything is nuanced to be very specific to everybody. So that's one of my favorite things about plastic surgery.
Wow, that's really cool. And I feel like even myself, I always just assume it's all cosmetic, but once you really get into it and learn a lot more, you realize that it is, you know, so much more than that. So I'm really curious, you know, you're our second male guest that we've had on the podcast. And so how do you feel that you guys are able to empower women and help them to feel their best self?
That's a great question. You know, surgery is one tool that can really help people with their both the way they feel and the way they think about themselves. And I think it's evident every day we see guests. I mean, we're definitely empowering people both with plastic surgery, but also non-surgical things, non-surgical aesthetic treatments as well. So helping people look and feel their best, helping them, you know, look how they feel. Some people look in the mirror and they don't see what they feel. They don't see who they recognize. And we've got options to help that out. And it's incredible to see the impact that has on our guests. And just when they come in after their procedure or after, you know, they're pretty much through their recovery, swelling, bruising's gone, if there's any of that, and just to see them light up and see how thankful and grateful they are, it's pretty awesome. It's one of the best things about my job.
Yeah, and sometimes it may be a non-surgical solution for a guest as well. Surgery isn't the answer for every patient every time. So kind of having that full consultation experience with Dr. Adams to get to come in and they have their images taken, they can look at their photos with him to do a full assessment. He'll do an assessment on the body at the time of their visit as well and see if they're a candidate for surgery. There's just a lot that goes into it. So just kind of having an expert like Dr. Adams is the way to go.
Most of it's education. Just simply educating by itself can be empowering. And that's what pretty much the consultation, whether it's with our non-surgical aesthetic team or with myself, I don't tell anybody what to do. I give them the options. I educate on why I think one might be better than the other, but it's really a joint decision. And that's an important part of the consultation.
Mm-hmm. Yeah, absolutely.
Absolutely incredible. So I'm sure with that, you have had so many different people come to you and experience kind of those moments that you just explained where they look in the mirror or they feel better. So can you give us maybe a very broad success story that has really stuck with you?
Oh yeah. Let me think on that one. There was a guest recently, actually she's a few months out now, but she came to me a few months back and her main concern was her face and the changes she had on her face. She had lost a lot of weight. And when she lost a lot of weight, she lost a lot of the normal fat that's in our faces that we all lose starting in our 30s, but she had just lost a disproportionate amount. That caused some sagging and really caused her a lot of anxiety and dissatisfaction when she looked in the mirror. And she came with her husband and it was starting to be a big problem for them. And she was down a lot. And we set up a plan. We got a kind of a multimodal plan, sprucing up her skin with some aesthetic treatments, BBL, Halo, Diamond Glow, all those. But we ended up settling surgically on a facelift, but adding facial fat grafting to that. So with fat grafting, we take fat from another part of the body, typically a stubborn area like the tummy or the thighs. We clean that fat and then we inject it back in, similar like to what you would do for a filler, like a Juvederm or something like that, to help replenish those fat compartments. And, as you can imagine, you got some bruising and swelling for a couple of weeks with a procedure like that. But when we saw her back at her 1 month, she was just glowing. She was beaming. Her husband was with too. Her husband was beaming and glowing. And we just saw her back recently. She's a few months out now. And it's just the change from that first time we saw her and met her to how she comes in now. And she's just radiant and excited and happy. And it's just incredible to have that the ability to help impact somebody's life like that.
Mm-hmm. Yeah. And how incredible that you get to watch those moments play out and see kind of that progression and be a part of, a pivotal moment for someone's life. And I know it's, people always say it's deeper than skin deep, but really things affect people differently. And if they come out happier and confident and, really proud of where they're at, I think that would be so incredible to be a part of.
Mm-hmm.
Yeah, it really is. Just being able to be with patients, when they're taking those bandages off for the first time, there's often happy tears involved in that. It's a life-changing moment, and it affects how they act and look, feel, for the rest of their life. But we really have so many touch points with our patients all along the process that you kind of get to know them. They're your friends, right? Like they're coming in, you're getting to know their spouse or their sister or whoever their support system is. And it's just so much fun to get to build those relationships and see that transformation for them play out from start to finish.
Mm-hmm.
So incredible.
That's so cool. And then if somebody, looks good, they feel good, and then it just radiates and spirals all throughout their life, and how they treat people and how they feel. And so you mentioned halo. What is that? I've heard of the other two things you mentioned, but do you know what the halo is?
I think I do, but I want to hear. I want to hear what
Yeah.
your explanation.
Halo is an awesome treatment. So the other two I mentioned were Diamond Glow, which is like a microdermabrasion type facial, and BBL, which is broadband light. Halo and BBL are both on the Cyton platform, which is the laser platform. Halo is incredible. It's called a hybrid laser. That's what the H stands for in Halo, but it's the only laser. It has two lasers in the same handpiece that shoot down the same path. And it's not kind of mowing the grass. It's more like aerating the lawn. Mm-hmm. So it causes really controlled injuries to the skin. And what that does is it stimulates our body's normal wound healing response, which is to make collagen, which is what we're all losing every day. So it helps to build up that collagen. It's great for texture of skin, so pores. Your pores are large. For the tone of the skin, so when we get some dark patches, that in combination with the BBL are really great. And it can help fine lines and wrinkles too. And we do something here a little bit different. We do a lot of Halo, but we do something called Halo Advance. And what that is, it's pairing the Halo, which has got a little bit of social downtime. It's typically 5 to 7 days. You're pink for a couple of days, and then you get kind of sandpapery. But pairing that with more aggressive deep laser resurfacing, specifically around the mouth, which is a really common area. The lines, like when you pucker up, there's really not a lot that fixes those except deep laser resurfacing. So Halo Advanced is the normal Halo plus deep resurfacing around the mouth. We can do the under eye area too. So it's an incredible treatment. It's part of our main. We have a package we put together called the Glow Standard. That's it's things that are, everybody's different, but these treatments are good for probably 95% of guests to really be an annual maintenance package. Basically, it involves Diamond Glow, it involves BBL, and involves one Halo a year too.
Yeah, and I think one important piece to know about that with the deep laser resurfacing is that it's unique to us because it's something that Dr. Adams himself has to perform. It's not just, I shouldn't say just, but it's not a treatment that's performed by an RN. It's specifically done with Dr. Adams' hand in the office. So it's one of the best. It has a really great outcome. Yep.
Yeah.
That's awesome.
And that's just one of many things that you guys do. And I know the list is probably so overwhelming and probably not something that we can cover all in just our time with you today. But, you mentioned that the Halo is something that you hear a lot of your patients have interest in. So can you kind of break down some of those common areas that you hear your patients wanting to tackle, and what are those options that you feel tend to be the best route for them?
Yeah, I think some of the most common requests that guests have, facial rejuvenation is definitely a big one. I hear a lot of patients say, especially with aging, they say that they don't recognize who they see anymore. Or they don't. What they see is not how they feel on the inside. They may feel a lot younger than what they're appearing, and that has to do with sun damage catching up. Even when I was really young with sunscreen, we weren't wearing it all the time. And if you think of the generation before, it was even less, and lathering up with baby oil. And that stuff catches up. It takes time, but it catches up. So that's a pretty common question we have. Another question, we have a lot of guests coming to regain or enhance some of their confidence, commonly after either a lot of weight loss or changes from pregnancy are really common, both with breasts and the abdomen or the tummy. So those are some of our most common surgical procedures, as breast rejuvenation or breast enhancement and tummy tuck surgery.
Mm-hmm.
I would say in combination with that, it's probably, again, with some of those non-surgical services. For example, if Dr. Adams is doing a full facelift, neck lift, fat transfer, it typically doesn't end there. We would follow up with the guest, obviously, through all of their post-op appointments. And then around that 3-month mark, when things are kind of close to their final result, we're able to say, okay, let's have you meet with, Natalie, our laser expert, and she's going to walk you through the steps that you can do to maintain your skin health. Because you invest a lot of time and money into getting that perfect result, and you want to maintain that as long as you can. So just kind of having that extra person and being able to continue on, their skin health is an important piece.
Yeah, facial rejuvenation is really it's a lot of fun, but there's prep work beforehand to get the skin ready, because healthy skin with good elastic fibers, good collagen is going to lift better, right? I just lift the skin up. If the skin's has a lot of sun damage and things like that, the surgery itself won't fix that. So it's really important in educating guests that we want to prep your skin, medical grade skincare. We want to get the texture, the tone better, either with Halo or BBL. And then those continue afterwards too, right? At the 3-month mark, like Molly said, we talk with our guests and we say, here's what we need to do to help maintain your investment, right? You invested a lot of money into facial rejuvenation, and it doesn't stop there. It's not a one and done. You want to prolong this as long as we can. And we really sit down and get a comprehensive consultation to really hit and check all the boxes to make sure we're maintaining collagen, we're maintaining that result.
Mm-hmm. Yeah, that is so awesome. We've learned with a lot of the guests that we've talked to, the maintenance of truly, it's so applicable to all assets, not even just skincare, but health and fitness is so much. It's so important in order to prevent some of these other things. And I'm curious, this isn't a question we sent you, but I have to ask. So between some of these lasers that you guys have talked about, what would you hold to a higher value as opposed to a laser or some really high quality skincare? Because I think for Paige and
That's a good question.
we are so, and I'm sure many people in our age group were so oversaturated with buy this cream, buy this, do this. Mm-hmm. And part of me is like, man, hearing about these lasers, should I really be just investing in something like that as opposed to, this really expensive moisturizer that I'm using daily? So what is your take on that?
Yeah, that's a great question. So the answer is both. Well, kind of. You don't need a really expensive moisturizer. Moisturizers are pretty basic, but there are a lot of. Some skincare is really expensive. Mm-hmm. I would recommend. I recommend for all our guests and for all your listeners that make sure that it's a medical grade skincare. So, and what I mean by that is typically that's physician dispensed. There are certain companies that are medical grade, but those are held to higher standards than something you could buy at Sephora or something like that. Medical grade means that there is evidence behind it. It means they have to do scientific studies to prove its efficacy. And you don't have to do that for most over-the-counter stuff. These are over-the-counter, but they're physician dispensed, and they have a plethora of literature to support them. Mm-hmm. And not all skincare lines have that, and we only carry skincare lines that have that and have good evidence to support them. So that would be number one. A sunblock, a sunscreen that's the foundation of everything, right? That is the cheapest anti-aging we have by far. So everybody should be on a sunblock, have a sunscreen every day. As far as the laser treatments go, they're really tailored towards different conditions. Some common conditions, melasma is really common. Melasma is kind of an overactivity of the pigment cells in your skin, and it can be hormonal. Sometimes it can be in the upper lip. People complain that it looks like mustaches. There's no cure for melasma. It tends to burn itself out with time, but really the goal is to try to minimize that down. And that is a comprehensive approach for that. Number one, it's trying to avoid the sun as much as possible because that's what can trigger it. The other thing is some skincare that has brightening effect in it. There's a number of compounds within the skincare that kind of turn off those cells so they're not making that pigment, not making things dark. And then it's typically either the light-based treatments like the BBL or the Halo we talked about, or a chemical peel like the VI peel is really common with that, especially for guests that have a little bit darker skin tone. The VI peel is a really great option for that.
The nice thing I think about kind of your age group and what you're saying with not really knowing how far you need to dive into all of these, lasers and skincare, et cetera, is that you can come in and have a consultation with our experts anytime. Mm-hmm. They're going to tell you kind of, here's the different things that we offer. Tell us about your problem areas. You can break it down and they can perfectly curate a plan for you that's going to take care of, whatever your concerns might be. Another important part with our skincare is that, like Dr. Adams said, with our medical grade skincare, he has kind of curated some different lines that we use in combination with one another. So we don't carry just one full line of any specific brand. It's all products that he believes have been, tried and true, tested, and we've all used them and loved them. So we're able to kind of tailor that a little bit more, which makes it really nice.
Mm-hmm. Yeah, I think that's great. Sometimes I feel like you got to use every product from this certain line, but it's like, that's not really true because it doesn't.
Overwhelming.
Yeah, exactly. Yeah, for sure. So I'm curious on why you don't recommend, well, and maybe you do recommend, but how come not a super expensive moisturizer? Or also too, if there was like one product that you would suggest splurging on, what would that be?
That's a good one.
So there's kind of four staples of skincare that I like to talk about. Number one is a good cleanser. Pretty basic. If you don't have sensitive skin, something with a little alpha hydroxy acid in it helps shed some of that top layer. Number two is a daily sunscreen. Talked about that every day. Number three is retinol. Everybody should be on a retinol. Retinol's been around forever. It's tried, it's true. It helps turn over the cells just a little bit faster, helps brighten that skin out, can reduce risk of skin cancer too, which is awesome. Some people complain about retinol as, my face gets red, it gets flaky. That means you just have to slow down a little bit. If you go too aggressive with it, you will have that. So you just back it off a little bit and slowly work your way up over a few weeks. And then the fourth one is a moisturizer. Moisturizers can be pretty basic. Most products we carry, they happen to have a moisturizer in them. So there are all these other things, but then they happen to have a moisturizer in them. So those can be a little bit more expensive. There is a fifth. The fifth one is a growth factor serum. That's kind of the crown on top, so to speak. And one of our favorite products is from Skin Medica, and it's called TNS Advanced Plus. And that's got about 15 different things in it, but it actually has human growth factors in it. So if you think about, you put some skincare on, how long does it take to, for you to have an effect? The studies show noticeable changes in 2 weeks, which is like light speed for just something as simple and topical, but it's a little bit pricey. And that's because it's worth it. So that's kind of the holy grail of skincare. And it's for good reason. And that's, I use a sunscreen, I have a moisturizer, and then TNS is pretty much what I use. I don't practice as much as I should, as much as I preach with things, but TNS by far is the best. So
that's awesome. Interesting. I've never heard of anything like that. So that is really interesting. Yeah. And I'm sure with all of your patients and everyone who you guys get to work with, I'm sure there's a lot of kind of cracking some misconceptions about, you don't actually need to use this serum or this particular thing. And I think something, being that the surgery side of your guys' business is something we're definitely not as familiar with. Mm-hmm. And I would assume our listeners probably aren't either. I'd love to kind of circle back to that portion of what you guys do and speak on some of the misconceptions that you guys commonly hear with the plastic surgery side of your business.
That's a great question. Some common misconceptions. Most people, especially with facelift surgery, people balk. I mean, they'll come in and they say, "Oh, I have jowls," or things like that, and you say the word facelift and they just shut down. I think there's people think of overdone, tight, windswept look, and it takes, we walk through the process, and no, we don't really pull on the skin. We're really lifting the deep layers up to help move those fat compartments. We're reinflating or filling up those fat compartments. There's about 27 of them. We start losing volume in our 30s. Let's see. Other misconceptions. I think, again, on the same line of facial rejuvenation, that they're going to look like somebody else. I think everybody has seen the celebrity that's had that bad look, and they're concerned about that. And really, that's not what happens. It's really more of just a little spruced up, better version of yourself. And most guests say, nobody asked me what I had done. They just said, "Oh, you just look refreshed," and that's really important. That's really important for me and the results I deliver to my guests, but also it's important to the patients.
Yeah.
Mm-hmm.
Yeah, I think another one is that, it's not all what you see on TV when it comes to plastic surgery in a plastic surgeon's office. I really think our entire team is very down to earth, and we're going to be honest with you, and we're going to treat you with compassion and kindness, and we want to hear your story and what your concerns are. And same with Dr. Adams. I know he would never toot his own horn, of course, but he's just the most personable guy. I mean, you just can't help but love him. So when patients come in and meet with him, it's like their worries just kind of melt away. So it's a vulnerable place to be in as a patient. I've been a patient of Dr. Adams myself. So I've done all the things that our guests have done, which has really helped me to kind of speak to the process and what it looks like and what it feels like. And he just couldn't have made it more comfortable for me. So it's easy for me to tell guests that they're going to have a great experience because I had one.
Mm-hmm.
Yeah.
I think those are great misconceptions that you guys just tackled, especially the celebrity and kind of what we see in the media. It can be portrayed so differently. And I think people have given social media and TV and those really produced outlets a little bit more grace into, hey, this isn't real life. But I do think your industry is something that not everyone experiences. So it's a little bit harder to imagine something outside of what we see on TV or through celebrity pop culture.
Mm-hmm.
And I was guilty of that when that orthopedic surgeon told me about plastic surgery too. I had the same misconceptions, and my eyes were open. So
it doesn't always have to be dramatic or to the nine, so overdone.
It's on TV because it's entertaining, right?
Exactly.
It's actually dramatic. So
yeah. So kind of talking about how plastic surgery has changed and evolved through the years. Can you kind of speak on that and how it has evolved through the past?
Yeah, absolutely. So we definitely have a better understanding of the aging process and what happens and what changes. And really there's four main kind of pillars of aging that happen. And historically, gravity gets all the credit, like, oh, I'm sagging, I'm drooping, I have jowls and breasts. Breasts are sagging and drooping, but really what we figured out is gravity is probably one of the least important ones. Of the four, gravity is one of them, but probably the least important. Volume loss is probably the most important one, and that bounces back to the kind of the fat compartments we talked about in the face. Even the breasts after pregnancy, after breastfeeding, a lot of that breast tissue just atrophies away and deflates and causes can cause some drooping with that too. That can cause drooping in the face. Since we figured that out, that's why injectable fillers have been a lot more popular and a lot more common recently, is because those are going to help reestablish some of that volume that's lost.
Mm-hmm.
And again, that's another misconception, right? Everybody that has filler looks like they have filler. Wrong. Most people that have filler, you have no idea they have of filler. And if you notice it, then maybe they had too much. So that's another really common misconception. Third one is going to be kind of skin surface stuff we talked about. Sun damage is the big one, environmental toxins. And then the fourth type of aging is what we call dynamic changes. And that's all the muscles that move, right? If we scowl, we get lines in here. When we're young, the lines form, but they go away right away. We do that several million times. Those lines kind of reinforce into the dermis, and then we have what's called static lines. So if you've ever heard Botox being preventative, that's kind of what that means, right? And Botox is going to help stop those muscles from moving, stop that crease from forming, and prevent it from making a static line with that. So, and all four of the pillars have different treatments, and surgery really just dabbles in two of those. So,
yeah, the gravity thing. I'm really happy to hear that is the lowest of all four, because it can't be controlled. It is what it is.
I can't do anything about it. No.
We're not.
The only thing I can do is just lift it back up. So
yeah,
I think male aesthetics is definitely growing a lot too. I mean, that's something that's evolved. It's still definitely a minority, but it's growing, especially even non-surgical. So jawline filler to help kind of establish a nice sharp jawline, even chin augmentation to help give a strong jaw and chin. Those are all really common, but we've got a fair number of male guests, kind of surgical and non-surgical, and it's only growing, and it's fun to see. We're a lot slower to pick up on that stuff, and but I think men are starting to see the picture and trying to age gracefully.
Yeah,
I like that you said that, because I definitely think that's something that gets forgotten about. Everybody just assumes that men don't partake.
Yeah.
So,
no, that's definitely a misconception, and probably something that's evolved a little bit too long there.
Yeah.
Absolutely. Yeah. Technology is probably another thing that's come a long way, just like it has in everything, with our lasers, with our chemical peels, surgical techniques, all that stuff is incredible every year how much it changes and evolves.
Yeah. And personally, I've heard of surgical techniques even outside of probably just plastic or, what it is that you guys specialize in. And it's so microscopic. It's so teeny what people can do now, where recovery time just seems to be getting less and less for people.
Absolutely. Yeah. Even, you think of, I do a fair number of breast reductions, but back, well before I trained, patients used to get admitted the night before for a breast reduction, and they'd often have blood transfusions, and they'd stay in the hospital for 3 nights. It's an outpatient, it takes about 2.5 hours, 3 hours. It's an outpatient procedure now. It's just crazy. I think mentality has changed, and, but techniques have definitely improved, optimizing outcomes, optimizing scars, optimizing results, all that stuff. It just keeps getting better and better. It's awesome.
So cool to see. Well, we have a
really fun game.
And you've already kind of touched on a couple things for it. So you've almost prepped yourself, but we want to take it back to some of that pop culture conversation, because we all know celebrities and we all know that they have great people helping them age gracefully, but we want to know if you can maybe give us some insight that the average eye can't detect. So we're going to be giving you some very high profile celebrities, and we'd love for you to tell us what you think. Obviously, this is, just assumptive, but what you think they possibly have gotten done.
Ooh. I will do
speed dial, so don't worry, we won't tell. No, I'm just kidding.
Okay. Yeah, that's the thing. It's plastic surgery that's done well, like I mentioned before, is you can't tell. So I will dabble a little bit and see if I have some insight on what that might be. And I'm willing to bet that all of them live extremely healthy lifestyles and are doing all of the non-surgical things on a regular basis. That's my guess. But let's
And
see what you
great
got.
skincare.
And great skincare for sure. That's a staple. And
Okay.
yeah, let's see what you got.
Yeah.
First one being Beyonce.
Oh boy, Beyonce has got glowing skin. She radiates. I don't know if she's had surgery. It's hard to say. She's been, even since Destiny's Child, was pretty young growing up.
I'm impressed with that pop culture.
Destiny's Child. I don't know. Nothing. I haven't stared at Beyonce in a long time, but nothing has really jumped out as there's no really what can give away a surgery is, obviously scars and incisions and things like that. But oftentimes if things are just a little distorted or a little out of proportion. And I think Beyonce's got great proportions. She's, I don't know. I don't know if she's had anything done. I know she's taking very good care of herself.
I mean, she's been beautiful forever. So I wouldn't be surprised if you're spot on there.
I mean, genetics are huge, but genetics are not everything. It's you made the analogy before, right? Like going to the gym, everything is maintenance, right? You can't, put your skincare on once a week and be set, or you can't have, one BBL treatment and you're good for the rest of your life, right? It's maintenance, just like the gym. You got to be there every day, 3 days a week. You got to keep going. You got to keep pushing towards your goal. And all of these people, I'm guessing you're going to say, certainly Beyonce, she is motivated, she is regimented, and she's hitting it hard, probably at the gym and probably with self-care.
And you know what? And that's why we love her. That's why we love her. All right. In a similar category, I think definitely on the same wavelength here is J-Lo.
Oh, J-Lo. This is funny. We were in San Diego for the aesthetic meeting, Molly and I and a couple other of the team, and our Uber driver was talking about J-Lo and how she has this very fancy cream. It's not a medical grade cream. I don't even remember what it's called. Molly probably remembers it. But the Uber driver's like, I think J-Lo takes baths in this stuff. It's like $500 a cup. I think she takes baths in it. And I say, and then J-Lo's got a new line, and I think she probably puts it in her new line. I was like, J-Lo's not, maybe she's using that, but J-Lo's doing everything. J-Lo's actually been pretty vocal about using M-Sculpt Neo.
Oh, what's that?
So M-Sculpt Neo is a non-invasive, basically it's a muscle building fat burning device. So a lot of people have heard of cool sculpting, which kind of freezes away fat. M-Sculpt Neo warms the fat. It can be treated in several areas around the body, but it warms it up, but it also has muscle stimulation. So at the same time, you're building muscle and you're burning fat away. So with that warmth, it helps to tighten skin real subtly. But with a series of treatments, like 30% fat reduction in thickness and 25% muscle growth, it's like a half hour each time. So she's been very vocal about that. There's a few people that it's a great treatment.
Yeah.
Cool.
And I do know J-Lo does not drink alcohol too.
Yeah,
I know that has
helps.
probably played a role in her looks.
That's a big one. Yeah, that's the environmental toxins part of the changes that happen.
Totally.
Yeah.
Surgery wise, I don't know. She's always been healthy. She's always been glowing skin. She's always been beautiful. She's always been confident. I wouldn't be surprised if she probably hasn't had anything done either.
Wow, this is crazy to me, but I believe it. I totally believe it. Yeah.
Again, it comes back. It's regimented, it's maintenance, it's dedication. And these are some very dedicated people.
Yeah.
Yeah. Okay. What about Kim Kardashian?
Natural, 100%.
Kim K.
I
don't know about that, but she also uses the M-Sculpt. I've seen her use that too. I know she's got some relationships with some pretty well-known plastic surgeons. I thought I heard a comment from Kanye one time about her butt, and indicating that maybe she had surgery with but it's hard to say. I don't know that I've ever seen Kim Kardashian, I don't know, 10 years ago or 15 years ago. I'm not sure what she looked like, if there was a big change. Before and after photos those are the giveaway. So you kind of need a good, solid apples to apples comparison. But like Molly said, I don't know. We'll see.
She definitely set the trend for, certain things in plastic surgery.
The other type of BBL.
Yeah.
Yes. That is so confusing. The BBL, because it's the broadband light, or what's the other one?
Brazilian butt lift.
Very different.
It isn't a lift, and it's not Brazilian, so it's not. It's it's become much more popular for sure, and likely in part due to her.
Mm-hmm.
So
I would say so.
Of course, she's always a trendsetter, whether it's good or bad thing.
Yes.
Okay, what about George Clooney? Oh, sorry, I just said the last one.
You got it.
My bad. Okay.
He's a handsome guy. He is. I don't know what George Clooney's done. I think George Clooney. He's got that. He's a silver fox.
He's aging gracefully.
He's aging very gracefully.
Yeah.
I hope to age as well as George Clooney.
You have all the right tools.
Do I? Motivation and he takes care of himself. I mean, that's a common thing. A lot of these people are celebrities because they're driven and they're motivated, and they translate that to all aspects of their life, and they take good care of themselves. And it's incredible how much, even if they're not doing all the treatments, but living a healthy lifestyle, eating healthy, exercising, just staying out of the sun, all those things have huge impacts. And oftentimes they prevent the need for surgery too. So
yeah. All right, last one. This one I am so torn about personally with my own opinions. Angelina Jolie.
She's got genetics. She's
really?
I just saw, maybe it wasn't recently, I saw a picture of her daughter. I mean, her daughter looks just like her. She's got the same beautiful lips. She's got the same heart-shaped face.
Porcelain skin.
Yeah. I think I think a lot of it's genetics, and some of us are more fortunate than others, but everybody can work hard and kind of maintain and build and basically preserve their skin. But yeah, I would bet not. I think she has always been, always had all those traits and always been just beautiful. And I think a lot of that's genetic, and I think again, another motivated body. She's doing all the things. So
that is
maintaining.
Yeah,
I love her. I think she's stunning. So
yeah. And what you
And
said about her children, totally. Now that you say, I'm like, yeah, that does make sense. They do all look exactly like them.
Yeah, I mean, they have a handsome dad too, but
It helps.
That helps. Yeah.
Oh, well, okay. I'm happy to hear that there is just really motivated people out there, and maintenance is key. I think that's the biggest takeaway from our game.
Absolutely.
Yeah, maintenance.
Absolutely.
There's hope. No,
There's hope.
There's hope for all of us.
Start with a baby step, washing your face every single night. I myself like to do it right when I get home, because sometimes at night after the hustle and bustle of putting kids to bed and brushing the teeth and all the things, it's like that might be the last thing that you want to do. But setting a little goal for yourself, something that you can do to make it easier, it helps.
And start simple, right? You don't have to have 15 things. Some people have 15 things, but
Guilty.
you don't have to have 15 things. There's the four staples that we talked about. Like, it doesn't have to consume a ton of time. And if you want to expand from there, that's definitely an option.
Yeah.
Yeah.
One last thing, just because I think you both just touched on absolute gold, is what are some easy, simple steps that really make a big difference? I know we've talked about sunscreen. We've talked about a great skincare routine. I love the, washing your makeup off right when you get home. Don't wait right before bed. Are there other just little small hacks, if you will, that you guys feel like really, really work extra?
Oh, that's great. I think you got one.
I think, definitely just exploring all the options that are out there. I think the M-Sculpt is a great hack because it's, similar to having 20,000 crunches in 30 minutes on your abdomen. So if you're somebody who is already hitting the gym and doing the most that you can and coupling that with the M-Sculpt, obviously your results are going to be optimal. So there's certainly tips and tricks like that probably a lot of these celebrities that we touched on are using, but you don't have to be a celebrity to have access to them, right?
Mm-hmm.
I think learning your options is important. Molly touched on it right at the beginning, and people get nervous coming into a plastic surgery clinic or an office. I mean, we really have put a lot of effort into making it a comfortable place, making it a fun place. I think we all have a lot of fun working here. I think a lot of people can see that when they're here. But explore your options. Don't be afraid to get a consultation. Our consultations are free. We want to make sure we have an opportunity to educate our guests, and you may not want to go and say, oh, I don't want to have a laser that may have some mild discomfort. I may be pink for a little bit. Start small. Educate you on how to take care of your skin. So not being afraid to take care of your skin, or afraid to at least explore some of those treatments. That's an important part. They can be, the word laser can be very scary, but it's really not. It's really just energy that's transmitted into the skin and helps it grow and flourish. So
those are great, simple hacks. Very simple. I agree.
Open-minded, and like all the celebrities, regimented. So you don't have to be quite that regimented. Every little bit helps.
Awesome. Okay, so we always ask our guests this towards the end of the interview, and so we'd love to hear from you guys what a queen means to you.
A queen. I guess looking back, I think my mom has defined what a queen is to me. She is one of the most kind people I know. She's really she's taught me a lot about being selfless, helping others, being compassionate, determined, and all these things have definitely got me where I am today and made me who I am. And these are all things that I pass on to my two little girls at home that I'm grooming to be queens. I think all of those things are traits that a revered queen has.
You married a queen, for sure.
I've got a queen at home. I carried this with me. So all of these traits I've carried with me. And, I married a queen, and we've got two beautiful girls, like I said, that are, I guess, princesses at this point. But
Queens in training.
Yeah, queens in training. There you go.
Queen is definitely a leader and somebody who not only expresses those characteristics, but helps instill them in others and makes everybody better and makes the world a better place. So
yeah, I think it's someone who just empowers, I want to say women, but I guess it doesn't have to be women. Somebody who helps them build up their confidence from the inside out. It spills out into every aspect of their life, kind of like we touched on earlier.
Contagious.
It's contagious. And, I am truly grateful to Dr. Adams for allowing us this space to get to do this with our guests all the time. It's very rewarding.
That's awesome.
Literally perfect answers. I
I
love the shout out to moms, especially right after Mother's Day. I think that is all the moms are all queens. We wouldn't be anywhere without them. So I love that.
Go moms. Yep. All right. Well, tell everybody how they can connect with you guys, learn more, whether it be schedule an appointment or a consult. Give us all the
Absolutely. Yeah. So probably the best way to learn a little bit about us and to get some contact information is our website, cfpsfargo.com. We are on Instagram, YouTube, Facebook, TikTok at Fargo Plastic Surgery. We have a lot of content there. We have an awesome marketing director, as you know, that keeps our content flowing and keeps it looking incredible. You can always call. You can schedule a complimentary consultation for our non-surgical services, and I'd be happy to see you for a surgical consultation as well. I think we're booking out pretty far though, so call soon if you want to get in. So.
Yes, he's a popular guy, that's for sure.
Awesome. Well, we will link it all. Yeah. We will include all this great information the week of your guys' episode. And thank you so much for sharing what you do.
Thank you for the opportunity.
Yeah,
This is really fun.
absolutely. And
So honored. Second male on here. This is great.
I know we have to do this, and it's been fun to be able to open that door to our guests for this year. So we're very pleased that we were able to do it.
Absolutely. Well, thank you so much.
Thank you so much. Yeah.
Yes.